Let's talk about asthma. Asthma is caused by an inflammation in the lining of your lungs. So your lungs are like, they're sort of like bunches of grapes really. If you look at, you've got a tube that comes down and there's lots of little airways like this, and there's millions of connecting tubes that've got lots of little airways on them, and so there are lots of almost like bubbles that are sitting around inside your lung. And if we look at this, each of these bubbles as a circle, around the wall of them is a muscle, and then the lining of them is like this, because your airway needs to get as much surface area as possible, so every little oxygen molecule you breathe can get into your bloodstream, which is sitting down in here. So there's lots of surface area, so that all that absorption can happen and your air can get in and your CO2 can get out. So what happens with asthma is, if we now look at that bubble, there's two things that happen. I'll make it a bit bigger so you can see more easily. What the muscle that's around here that normally sits there nice and relaxed actually tightens up, so it shrinks that whole tube down a bit. So even if there was nothing going on inflammation-wise in your lung, just the fact that that muscle shrunk up means that the lung lining's all jammed up now, and so the absorption's not so good. The other thing that happens, this is stage 2 with asthma, is you've got your muscles may or may not be tight, but then also where that lining is, it gets inflamed and produces fluid. So you've now got this jammed up lining, and there's fluid all in these holes and all the way around it. And so this sort of fills up, and that's where that mucousy stuff that people start coughing up, which is clear, but it's just because there's inflammation, and our body's way of dealing with things that annoy it is to bring all the good things there to help heal it up. But to get in there, it has to come in fluid. So all these little areas fill up with fluid. So when we look at the inhalers that we use, the inhalers do two things. The one that is, there's one that relaxes this muscle, so those are the ones that are the reliever stuff. So salbutamol is the common one. Butamol is the common one we use, and that's a short-acting one. And then there's other ones that are longer-acting, and they will let this muscle relax back out to the way it was before. The other thing that we use is steroids. Now the steroids work on this inflammation, so this is where your steroid inhalers come in, and they reduce the inflammation that's going on. Now, although you take a reliever, it will make you feel better. The steroid that you use is actually will treat the asthma. So it's important that you get some steroid in, especially if you're starting to need to use your relievers a lot more and make you feel better. So this is only the feel better stuff, whereas this is the treatment stuff. And it's important that you're using the treatment as soon as your asthma starts to flare up.